commencement address right now at the Air Force Academy where they're being very politically correct. Everyone's standing not 6 feet, but 10 feet apart, okay? And it's very different. I made that speech last year. I'm going to West Point. I think they're changing the date to June 13th because of what's going on in New York. They're moving it to June 13th, West Point. So I'm doing that commencement speech, and they're going to have, sad, but it's a big start. They're going to have the cadets. They may not have the parents, but they're going to have the cadets. The parents are so proud of them. I know at the Air Force Academy where Mike is speaking right now, they don't have the parents. They have the cadets. They're very, very widespread. And you talk about social distancing. I mean, they are really spread. I looked at it. They're using 10 feet. So he's doing that, but they're having it. It's very important to have it. And that's a great thing. That's a great thing. That's a big start. So he's there right now, and I will tell you, he's a gentleman, Mike Pence, a real gentleman. And they requested, the Democrat senators requested a phone call with him yesterday. And I think they had, for the most part, all of them on, like approximately 47. I heard it was just about all of them, whatever it might be. I don't want to be wrong by 1 or 2 or 10 and have the press say, he lied, that he told a lie. Terrible, terrible. Whatever it was, but they have 47, and I guess most of them were on. I heard they were so rude. I used the term today. I said rude and nasty, but I heard they were so rude. No matter what he said, which was all very positive in terms of winning this battle against the invisible enemy, no matter what he said, they were fresh, they were nasty, and it was, I heard, just a terrible thing. And I said, Mike, that's politics. That's what it is. If we came into this room today and said, the battle is over, we have won, it's 100% gone, the Democrats would say the president has done a horrible job. He has done a disgraceful job. It is a shame how bad he is. You know, this is the talking points. This is political, and it would be nice not to have that, especially when we've done the job we've done. I mean, all you have to do is look at the big V for victory or V for ventilator. Take a look at it. Everybody said they had us on that. They had us. They thought they had us, but we got them done at numbers that nobody would have believed. And we did use our act, our production act, and we used it, but we didn't use it. We didn't need it like a hammer. All we had to do, for the most part, we used it actually in a number of cases, but for the most part, all we had to do is talk about it. All we had to do is say, we're going to use it if you don't do this. And everybody was, for the most part, good. We used it a couple of times because it didn't work out the easy way, but it worked out the hard way. But whether it was masks or ventilators, it was incredible what we've been able to do. So this is a very critical time for the American people, and the American people deserve real information and responsible and thoughtful dialogue from their elected leaders and from the media. The media's been some very honest, but some very dishonest. You know that. I mean, I even read a story where Mark Meadows was a tough guy. He was crying. He was crying. There was a Maggie Haberman. She won a Pulitzer Prize for her coverage of Russia, but she was wrong in Russia. So was everyone else. They should all give back their Pulitzer Prizes. In fact, it turned out that the crime was committed by the other side. The crime was not committed by this side. It was committed by the other side, a bunch of bad people. You saw the reports coming out over the last 2 weeks. They got caught. So Maggie Haberman gets a Pulitzer Prize. She's a third-rate reporter, New York Times. And we put her name up here last week. You saw that. People thought it was a commercial. It wasn't a commercial. It's like a commercial, but it wasn't a commercial. It was just clips. And because we exposed her as being a bad reporter, what happened is she came out and said, Mark Meadows was crying, and they made it sound. I said, Mark, and it's okay if he did. I wouldn't, look. But I think he was crying probably really for the wrong reason they had it down. But he's not a crier. And if he was, I've known criers. I could tell you people that that are very famous, they cry, and that's okay too. But it was a nasty story in so many ways. It was fake news. And she only did it because we exposed her for being a terrible, dishonest reporter. She is. I've known her for a long while. I haven't spoken to her a long time. I made the mistake. I take a picture with her at the desk a long time ago. Every time she does a story, if I say, I haven't spoken to her in many months, maybe years, I don't speak to her. She's fake. A lot of people are fake. A lot of people. We get a lot of fake people. But what happens is she writes this story as retribution, puts it in the New York Times, and the New York Times is a very dishonest newspaper. It's my opinion. It's not an opinion. It's actually, from my standpoint, the very hard thing to figure, though, most people wouldn't know that, but I know because I know the facts. And they make up, I said it today, they make up words. Sources say, most often used, sources say. You know what sources say mean? Sources say means they have nobody, and they make it up, okay? And they have a few other type statements that mean the same thing. But sources say is the most often used expression in the Washington Post, New York Times especially, CNN, fake news, CNN. They should really be mandated, and I mean mandated, to use a name. If there's a source, use a name. Say that Kayleigh McEnany said, or somebody. And you'd find out that the, number one, the source wouldn't say it. The sources don't exist. I don't believe the sources exist. And I try and tell this, the beautiful thing about doing these conferences is that we have tremendous numbers of viewers, and I'm able to reach the viewers without having to go through fake news where they make a good story into a bad story. So with all of that, it's been an incredible period of time. We've done a fantastic job with the talk of other nations. The leaders of other nations are calling us for help. They're calling us for equipment. They're calling us for testing capacities. Now, with the testing, we are going further. Deborah's going to talk about that now. With the testing, we have some other tests coming up that are going to be, I think, phenomenal. I think they're going to blow away everything as soon as they come out. And we're going to get them out as soon as possible. But I'd like to ask Dr. Birx to come up and say a few words about where we've come, how far we've come, and more importantly, where we're going from this point. Because honestly, it's quite amazing. Thank you very much.
Thank you, Mr. President. If we could have the first slide. I wanted to give you an update on where we are as states and as counties and as cities. I know you all are watching carefully. The numbers have shifted over the last few days. What happens when when states change the reporting from confirmed to probable, so now all probable cases are included, they had to add them back in. Even though the cases may have been from March, they were added over 14th, 15th, and 16th of April, and states may continue to be adding them. Eventually, we're hoping that those get accounted for on the day when the presumptive cases or the probable cases were counted, but right now they're added in one fell swoop. So this is New York and New Jersey, and I think we all know how difficult and what a difficult time both New York and New Jersey have had. I call your attention to the axis. It goes up to 250,000 cases, so you can get a frame of how we're talking about some of the other metro areas. Next slide. These are the 25 metro areas, the top 25 metro areas, and you can only see the New York metro area in this slide. Again, the axis goes up to about 300,000. It includes the New Jersey part of the metro area as well as part of southern Connecticut. Next slide. But if I take New York out, and the reason I wanted to do that, now the axis is 1/10 of the previous axis. So that previous axis, the previous slide, 300,000. This slide, 30,000. So that will give you a frame of reference for some of these other metros. The reason I wanted to show you this is cumulative cases, and we are still tracking very closely the issues in Chicago and Boston. But on this slide, I hope you can see the yellow line. That is Detroit. And Detroit, and this mayor of Detroit has really done an extraordinary job, and the people of Detroit have done an extraordinary job with their social distancing. The other line I want to call your attention to is the line here. This is New Orleans. And I think, frankly, I was concerned about New Orleans because they had a lot of pre-existing comorbidities. They have 2 or 3 major hospitals, but cover a very large area of geographic area. And that other blue line that you can see that's down right here, that's the Seattle line. And you can see that their response, because of the nursing home alert, they were one of the first states and the first metro areas to really move to social distancing. And so they've really never had a peak like many of the other metros. Next slide. Then I just want to take you through some of these new case graphics. That was cumulative cases. This is daily cases. And obviously there's a lot of variability in reporting, but you get a sense over time when you look at daily cases. So New Orleans is on panel on your left and Baton Rouge on your right. But you can see clearly New Orleans about a month ago, very low levels, probably less than 50 cases, large peak and spike around the beginning of April, and they have come down, and they have down to very few cases. Again, I showed you before how both their syndromic cases have come down, as well as their actual number of cases. Next slide. This is Seattle, so you can see they had a much lower peak, and this is when we talk about flattening the curve. This is what flattening the curve looks like. It becomes a longer, slower decline, but it never gets very high, and then goes back down. Next slide. And then this is Detroit, and we always look at the metros as a consolidated, so this is both Wayne and Oakland in Michigan, and we really want to thank the mayor for the incredible job that they have done to really ensure that everyone is receiving the adequate health care and testing, and they've done quite a good job with testing in Michigan. But all of these states, Louisiana and New York, have tested 30,000 per million inhabitants. Those are some of our highest numbers across the board. And next slide. And so the president talked about the case fatality rates, and we've lost a lot of Americans to this disease, and we pray and hope for each one of them that are in the hospitals and the excellent care. What this graph illustrates is the amazing work of the American people to really adhere to social distancing. This was nothing we had ever attempted to do as a nation, and the world hadn't attempted to do. But they were able to decrease the number of cases so that in general, most of the metro areas never had an issue of complete crisis care of all of their hospitals in a region. And so you can see our case fatality rate is about half to a third of many of the other countries.
Excuse me, does anybody really believe this number? Does anybody really believe this number?
I put China on there so you could see how basically unrealistic this could be. When highly developed healthcare delivery systems of the United Kingdom and France and Belgium and Italy and Spain, with extraordinary doctors and nurses and equipment, have case fatality rates in the 20s up to 45, and Belgium is extraordinarily competent healthcare delivery system, and then China at 0.33. You realize that these numbers, and this includes the doubled number out of Wuhan. And so I want it really to put it in perspective, but I wanted you also to see how great the care has been for every American that has been hospitalized. And the extraordinary work of our doctors and nurses and our laboratorians on the front line who have been doing an excellent job. Next slide. And then we also wanted to show...
Also the number for Iran. Does anybody really believe that number? You see what's going on over there. Does anybody, you put that slide back if you would. Does anybody believe this number? Does anybody believe this number? You saw more
and this is why
bags on television than that.
This is why the reporting is so important. And I think you remember almost 6 weeks ago, maybe a month ago, I was telling you what Italy was showing to us and what France was telling to us and the warnings that they gave to us and said, be very careful. There's an extraordinary high mortality among people with pre-existing conditions. And we used their information to bring that to the American people. That alert before we even had significant cases, came from our European colleagues on the front line. And that's why we keep coming back to how important in a pandemic and a new disease, it's really critical to have that level of transparency because it changes how we work as a nation. It allowed us on over March 15th to make an alert out there about vulnerable individuals and the need to protect them. And my call out to millennials to really protect their parents, protect their grandparents, and get that information out to everyone, that there were pre-existing conditions that put people at greater risk. That information came from our European colleagues who were in the midst of their battle themselves. And so there is never an excuse to not share information. When you are the first country to have an outbreak, you really have a moral obligation to the world to not only talk about it, but provide that information that's critical to the rest of the world to really respond to this credibly. And I really want to thank our European colleagues who worked so hard to get us that information, even in the midst of their own tragedies. And I think that really shows how important transparency is. And we go to the next slide. We can show you this really encouraging and great news. So we know that fatalities will continue to lag because people are in hospitals still, and some are still in intensive care units. But these COVID-like illnesses, this is our hospitalizations that are related to flu per 100,000 Americans. This is this year's flu season, and you can see our COVID-like illnesses, and this is all of them, probable and confirmed cases. Our hospitalizations are declining. Now, I showed you metros that have made tremendous progress. And we've been up here many times talking about it being 6, 10, 15 additional cities. And now we're really just focused on Chicago and Boston and Massachusetts, and really some issues that Providence is starting to improve now, so their relationship to the two large outbreak cities. But this is really reassuring to us of the progress we're making across the country against this disease. And I just really want to conclude by thanking again the American people for making these type of graphics possible. Thank the data team who puts these together for me. So they are working till about 3:30 every morning to make sure that we have the most up-to-date information. That's the data that goes to our supply chain individuals to ensure that every hospital in every state and every community has what they need based on data, and to make sure that we're serving the needs of the American people as effectively as possible. Thank you, Mr. President.
Thank you very much. You did a fantastic job. Thank you, Rich. Thank you very much. The fact is that we've been learning a lot from Deborah, Tony, and so many of the professionals, the director. PEPFAR, we're spending the United States, with that help, to the best of my knowledge, mostly in Africa, $6 billion a year, and that's on AIDS. What we've done for AIDS in Africa is unbelievable. We spend $6 billion a year. That's been going on for a long time. Nobody knows that. You've never heard that. I've never heard that. $6 billion a year. Millions of people are living right now, and living very comfortably, because of the fact that we have found the answer to that horrible, horrible plague. That was a plague. But we spend $6 billion a year. And from what I hear, it's very well spent, done by professionals, including this great professional right here. That was the thing that you worked hardest on, and something that was very close to her heart. So it's, it's something that I think people should start hearing. The World Health Organization, we're just finding more and more problems, and we spend this money really well. There are other ways we can spend the $500 million. That's $500 million. This is $6 billion. But we can find other ways to spend it where people are going to be helped, we think, in a much greater way. We're doing some research on certain people that take a lot of credit for what they do. And NIH is giving away a lot of money. We give away for many years, they give away a lot of money. And some people complain and some people don't. Some people are extremely happy. So we're looking into that also. They're giving away approximately, as I understand it recently, more than $32 billion a year. 32 billion. And so we've been looking at that for a while, and we're going to be having some statements to be made about that. $32 billion a year. It's a lot of money, and we want to make sure it's being spent wisely, and we've been doing that, by the way, and we'll have some statements on that. And those are much bigger numbers than what we're talking about with national. If you look at with our friends from wherever they come from, 500 million is a lot of money, but it's not a lot compared to the kind of money that we give out. I think over the years it's been averaging about $32 billion. 32 billion. So we've had our eye on that one for a while. We also talked about the lab in China, where I guess 3.7 million was given some time ago, and we're looking at that very closely. Chief of Staff has that pretty much under control, but it's money that, too bad it got spent there. But that was spent, what year was that, Mark? It was 4 or 5 years ago?
Over the last 6 years.
6 years ago, approximately. So we're looking at that, and that's the lab that people are talking about. All right, so we're looking at a lot of things. There's tremendous waste in our government. We found it in many different ways and in many different forms. And this is one of them. This is one of them. We can spend, I was talking to Dr. Birx, we can spend $500 million using all of it in a much more efficient manner if we choose to do that. And it'll be to the good of many more people than are getting it right now. But you look at the mistakes that were made, I mean, so late, long after I said we have to close off our country. They were actually against our closing off our country to China when I did that in January. They were against that. They didn't like the idea of closing off our country. They said it was a bad thing to do, actually. And they've since taken that back. But it was a very lucky thing that we did it, very lucky. We would have had numbers that were very significantly greater. Tony Fauci said that. He said it would have been very significantly greater had we not done that. So we made a lot of moves that were good moves, but it's still a very depressing subject because it's a lot of death. And if it was stopped very early on at the source, before it started blowing into these proportions, you have 184 countries that would have been in a lot better shape. But our country is getting back, and I expect that we're going to be bigger, better, and stronger than ever before. I will take a few questions. Jeff?
Mr. President, you've mentioned, and the doctor has mentioned China a few times today, that clearly suggesting that the data has not been good. And
Well, you tell me, do you think that data is good when you see that? Do you think that's correct, okay? Do you honestly believe that's correct?
Pretty dramatic contrast. So my question for
Dramatic?
you,
Yeah, that's dramatic.
so my question for you, sir, is
Why didn't the press, why didn't you people figure that out, though? Why do we have to put up a chart? The number is impossible, it's an impossible number to hit. But why haven't you come up and said that?
the question, sir, is China now cooperating with the United States to figure out what happened, and what do you want from them now?
Well, they said they're doing an investigation, that they're doing an investigation. So let's see what happens with their investigation, but we're doing investigations also. Yeah, go ahead, please.
Thank you, sir. You've spoken, we heard Dr. Birx a moment ago say that every country has a responsibility to tell the rest of the world what's going on. You've talked repeatedly about how this could have been stopped in the past. I know you don't want to telegraph what you would do, but do you think that there should be some consequences if in the end, China was responsible for all of this?
Well, if they were knowingly responsible, certainly. If it was a mistake is a mistake. But if they were knowingly responsible, yeah, then there should be consequences. You're talking about, potentially lives like nobody's seen since 1917. And, the other thing, had we not done what we did in terms of closing, because there is that concept of let's let it ride. But at some point, I'm going to have to, I don't want to embarrass countries that I like and leaders that I like, but you have to see some of these numbers. In my opinion, so we're talking about maybe 60,000 or so. That's a lot of people, but that's 100,000 was the minimum we thought that we could get to, and we will be lower than that number, anywhere from 100 to 220,000 people. But I really believe it could have been billions of people had we not done what we did. We made a lot of good decisions, but one of those things. Go ahead.
Have you ruled out that this was an unknowing situation? Have you ruled
I haven't
that
ruled
there was
out
no-
anything. I want to
Okay.
look at the facts as they come in. No, I want to look at the facts, please.
Thank you, sir. Thank you very much, Mr. President.
Sure.
Last week, you claimed that you're in charge of everything, yet the American people don't understand why you're unwilling to use the awesome powers of your presidency to make American companies manufacture the PPE and also the testing equipment that you
Who
need
you
to
with?
implement your recommendations.
I know, but who are you
on
with?
How, I'm with TMN. Recommendations for
TMN, what is
Talk
TMN?
Media News.
What?
My name is Doug Christian with Talk Media News. Yes.
Talk Media News.
Yeah. And
Go ahead, keep reading your question.
the thing is how to make companies build these testing equipment so that you can do what you want.
Well, we're doing that right
recommended.
now. We're doing it. We're doing it right now with ventilators. We have General Motors, we have General Electric, we have 11 different companies, great companies building them for us all over the United States. We're starting to make our own gowns, as they call it. We're making some incredible things. And as far as the testing is concerned, most of that now is done in the United States. We're doing it in the United States, our different platforms. And so I just don't think you were
But
listening.
Senators were complaining to,
Which
to
senators?
Vice President
Which
Pence
senators?
yesterday.
Which senators?
Independent Senator Angus King.
He's not an independent, okay? Angus King is worse than any Democrat. Go ahead.
But he said that he was livid, actually.
Of course he
this-
said that, because he's a Democrat, okay? Angus King is not an independent. He uses that term for whatever reason. It's a waste of time.
But he's not a very emotive type
Oh,
of
yes, he
senator.
is. You haven't seen him, okay? You haven't seen him, no. Angus King is a Democrat, and that was totally staged. I heard that, and it was totally staged. Just like you read the question, he read his question. Yeah, please, in the back.
Mr. President, I want to ask you about one of your retweets that you.
Which one?
The one you retweeted from Paul Sperry. Let's see if authorities enforce the social distancing orders for mosques during Ramadan like they did churches during Easter. I'm wondering.
Yeah, no, I would like to see that. And, you know, I just spoke with leaders and people that love mosques. They love mosques. And I'm all in favor of that. But I would say that there could be a difference, and we'll have to see what will happen. Because I've seen a great disparity in this country. I've seen a great disparity. I mean, I've seen a very strong anti-Israel bent in Congress with Democrats. It was unthinkable 7 or 8 or 10 years ago, and now they're into a whole different thing between Omar and AOC. I say AOC plus 3, add them on. You have, I mean, the things that they say about Israel are so bad, and I can't believe it. Now, just a minute. So I would be interested to see that, because they go after Christian churches, but they don't tend to go after mosques, and I don't want them to go after mosques, but I do want to see what their bent is. Yes, please, in the back.
Though, Mr. President, that in fact
Go ahead,
that you're
please.
suggesting that imams wouldn't follow social
No,
distancing?
I think that I just had a call with imams. I just had a call with ministers, rabbis. We had a tremendous call with the faith leaders. No, I don't think that at all. I am somebody that believes in faith, and it matters not what your faith is, but our politicians seem to treat different faiths very differently, and they seem to think, I don't know what happened with our country, but the Christian faith is treated much differently than it was, and I think it's treated very unfairly. Yes, please, go ahead in the
I
back.
just want to ask
Thank
though
you,
if the
Mr.
Department of
President.
Justice
Jen
will in
Pellegrino
fact
with
support.
OAN, please. OAN.
Thank you, Mr. President. The Paycheck Protection Program saved an estimated 15 million jobs. It's run out of money. The Democrats, specifically Nancy Pelosi, have been blocking that funding.
Yeah.
Do you know why Speaker Pelosi is dragging her feet on that?
Well, she thinks it's politics. I don't think it's good politics. Nancy Pelosi's been blocking it. Schumer's been blocking it. And I think they think it's good politics. I don't think it's good politics. I think it's bad politics, but I don't care about the politics. It's so great for our country because we're going to have all of these companies that are, you know, it's a bigger employer. Well, let's say it's the same, but essentially it's the same power, all of these small businesses added together, as the big companies, about 50-50. And it's so important, and they will be scattered if we weren't able to do what we're doing. And essentially, we're giving these small businesses that won't make it, they can't because they're closed. We're giving them money to take care of their employees, so when we open, they can get back into business. It's been a very popular plan, even with Democrats. I think it basically passed unanimously twice, the first section, which is $350 billion. So we're trying to get 250. Nancy Pelosi is blocking it. She sits in her house in San Francisco, overlooking the ocean, and she doesn't want to come back. She doesn't want to come back. She doesn't want to come back to D.C. She's got to get back and get this thing approved. It's very important. Please, go ahead.
Dr. Burks, if I may, you again praised the American people for doing their bit over the past few weeks. But what goes through your mind when you see photographs of crowded beaches in Florida? Is that a concern for when we start seeing some of these restrictions being lifted?
Well, as I described, we go metro by metro, county by county, and so I'd have to link that with a specific county and look at their case rates. I believe the governor and the public health system that Florida has, they have some of the best county public health individuals I have ever had to deal with. They are amazing because I had to work with them under HIV/AIDS. So if the county health directors believe that that's appropriate for their county, then I'm not going to second judge an individual's approach to this because I can't see into every single county and load the low rates. I can just see there's no cases. So I don't know if that's a county with very small cases or not, but I think their county health official would know.
And many of the counties, as you know, are really free of this horrible enemy. So we're opening up. You'll be seeing a lot of this country start to open up fairly quickly. Yes, please.
Thank you, Mr. President. You mentioned the importance of social distancing, but for example, Stephen Moore, someone you appointed to your Open the Country task force, is organizing a protest in Wisconsin, but aren't they in a sense protesting your very own guidelines?
Well, we have a flexibility. I didn't see what Stephen said. I can tell you he's a very good economist. He's been calling shots right.
He said we need to be the Rosa Parks of government injustices.
Well, there is a lot of injustice. When you look at Virginia, where they want to take your guns away, they want to violate your Second Amendment. When you look at, look, I'm getting along very nicely with the governor of Michigan, but she has things, don't buy paint, don't buy roses, she's got all these crazy things. I really believe somebody sitting in their boat in a lake should be okay. They shouldn't arrest people. Some of them are being unreasonable. I really believe that. They're being unreasonable. But I think Virginia's a great case, though, because they're using this. They're trying to take your guns away in Virginia. And if people in Virginia aren't careful, that's what's going to happen to them. So, yeah, I could see where he's coming from. I think it's a strong statement, because hopefully this will be over very soon for all of us. But some have gotten carried away. They have absolutely gotten carried away.
Protesters are protesting your social distancing guidelines?
I don't know. I notice there are a lot of protests out there. And I just think that some of the governors have gotten carried away. We have a lot of people that don't have to be told to do what they're doing. They've been really doing everything we've asked them. We have a few states where, frankly, I spoke to the governors, and I could have gotten them to do, if I wanted to do what would have been perhaps politically correct. But they've been doing incredibly anyway. And as one of them said, everybody's doing exactly the same. In fact, our record is better than states where they're under a mandate or, where they've agreed to do certain things. Now, we have some great states out there. We have incredible people in our country. And for the most part, it's a strong statement, but I understand where he's coming from. And I think one of the greats would be one of the really important places that people really have to start looking at is what's going on in Virginia, because that's a mess with really a governor that's under siege anyway. Yeah, please.
Thank you, sir.
No, with the beautiful head of white hair. Go ahead. I'll tell you if I like his hair in about a minute after he asks the question.
Move over to the Wall Street Journal. On that point, though, does the tweeting about, in the case of Virginia, linking the Second Amendment to some of these issues about lifting some of these restrictions in these states not potentially pose a concern for the governors and civil unrest and potentially in those cases? I have a second question too.
Well, I think, just for that question, I think that's an easy one. That's not even politics. We're entitled to a Second Amendment, and he's trying to take the Second Amendment, meaning that state is trying to take, the Democrats in that state, the Republicans are fighting it. They're trying to take that Second Amendment right, that Second Amendment right away. To me, that's liberty. That's, when I say liberate Virginia, I would say liberate Virginia when that kind of thing happens. And where does it all stop? So I think it's a very good analogy. Go ahead.
Sure, I mean, is this the right time to kind of bring in a Second Amendment issue?
I think when they talk about taking your guns away, and if you notice, at the beginning of this pandemic, there were more guns sold, I think, than at almost any time in history. So it's obviously a big issue. And then you have them working and signing documents trying to take your Second Amendment away, essentially. So I do think it's an appropriate time to bring it up. Go ahead, second.
This past week, after kind of an extraordinary slew of events from adversaries, North Korea, Russia,
Yeah.
China, and Iran, all kind of pushing back on U.S. policy or toying with U.S. military forces, what's your message for some of these countries who may be trying to take advantage?
I don't see it. No, I don't see it. We had a very good relationship with Russia. We worked on the oil deal together. I was with, by telephone, King of Saudi Arabia and the President of Russia, Vladimir Putin. We worked out a deal on oil. That was a very important deal to them and to us and to Saudi Arabia. It was in a deadlock. You know it. You covered it very well. Actually, Wall Street Journal covered that very well. I worked with Putin and with the king on that. And President Putin was a total gentleman, and it was very important to get that done. And the king was great. And we actually had to bring in Mexico because Mexico was a lone holdout, and they showed great flexibility. You know the story. No, I think we're doing fine. Yeah, sure. It's North Korea. I see they're testing short-range missiles. You know, been doing it a long time. I received a nice note from him recently. It was a nice note. I think we're doing fine. Look, if I wasn't elected, you would right now be at war with North Korea. Okay? I'll tell you for your people that don't understand the world and they don't understand how life works. If I wasn't elected, you would right now, maybe the war would be over, hopefully with a victory. But if you remember when I first came in, we didn't have ammunition. Not a good way to fight a war. President Obama left us no ammunition, okay? And he left us virtually no medical and ventilators. He left us, the cupboard was dry, right? The cupboard was dry. No, I think right now you'd be at war, essentially, in some form. Be over, it would be raging with North Korea if I weren't president. And we're doing just fine with North Korea, just fine. Let's see how it all ends up. You know, in the meantime, they said, oh, Trump's given up. And then they said, oh, really, what's he given up? And they said, I don't know. Then they said, he met. Oh, I met. No, I have a good relationship with Kim Jong-un. That's not a bad thing to have a good relationship. Obama wanted a relationship. He wouldn't meet with Obama. Wouldn't meet with him. Okay, have a good relationship with him. We met at the line. I stepped over the line. The first time anything like that's ever. It's all good. It's good. But when they say, the stupid people, I call them stupid people, or the haters, they say, Trump's given up so much. Really? I've actually increased the sanctions. China's been very good on the border. In fact, right now, the border is stone cold closed between China and North Korea. Our relationship with China was good until they did this. Once we found out about this, look, we just made a trade deal with China's going to have to buy $250 billion a year in our product, 50 billion from the farmers, 40 to 50 billion from the farmers. The relationship was good when we were signing that, but then all of a sudden you hear about this. So it's a big difference. You know, the question was asked, would you be angry at China? Well, the answer might very well be a very resounding yes, but it depends. Was it a mistake that got out of control, or was it done deliberately? Okay, it's a big difference between those two. In either event, they should have let us go in. You know, we asked to go in very early, and they didn't want us in. I think they were embarrassed. I think they knew it was something bad, and I think they were embarrassed. But, you know, no, I think we're doing very well. Well, so you said Russia, you said China, you said North Korea, Iran. When I came in, Iran was a terror. We had 82 points of fighting. We had 18 points of major confliction. The first week, I said, tell me about Iran. Sir, we have 18 points of confliction, meaning Yemen, Syria, all Iraq, they're going into Iraq all over the place. They're a much different nation right now. I stopped that horrible deal, and they want to talk, except that Kerry violated the Logan Act. He made the deal, and he doesn't want them to make a deal because I would have made a deal, in my opinion, except that John Kerry, who made the deal originally, which was a stupid deal to make, gave him $150 billion, gave him $1.8 billion in cash, in green. That would be more than this room 10 times with $100 bills. You could fill up this room 10 times with $100 bills, and it's not that small a room. And I say he violated the Logan Act. I think it was a major violation. I think we would have had a deal if it wasn't for John Kerry. But he doesn't want to be, number one, embarrassed. Number two, he said, let's wait till after the election. Maybe Sleepy Joe Biden's going to win. And if Sleepy Joe Biden wins, you'll own the United States. And China will own the United States. China's paid us, you know, from the Wall Street Journal, hundreds of billions of dollars. Is that right? Tariffs. And we gave a lot of that money, a small percentage, but a lot of money to the farmers. And it kept the farmers going great. Right? But hundreds, we're getting tens of billions of dollars in tariffs. And by the way, for those of you that say, oh, we're paying, China devalued their currency in order to pay these. We didn't pay. China paid. They don't like to write that. They also added money into their system, so they paid for that. No, I think you have numerous countries waiting to see whether or not Sleepy Joe wins, because if Sleepy Joe won, they own our country. They will take our country. You know, we had, go back 2 months, we had by far, and China was supposed to catch us. You know better than anybody, Wall Street Journal. For years I've heard, by 2019, China will catch us. There's only one problem. Trump got elected in 2016. That was a big difference. And we were going leaps and bounds above China. And before the problem with the plague, right? China was having the worst year they've had in 67 years. That was before the plague. Now they're getting really hurt, and so is everybody getting hurt. I don't want them to get hurt, but they're all getting hurt. Everybody's getting hurt. It's a horrible thing that's happened. But we had the greatest economy in the world by far. China isn't even close. Go back 2 months. And we're going to keep it that way. But when you mention Iran, Iran is a much different country than it was. When I first came in, Iran was going to take over the entire Middle East. Right now, they just want to survive. They're having protests every week. They're loaded up with the plague, which I don't want. I've offered to help them if they want. If they need ventilators, which they do, I would send them ventilators. We have thousands of excess ventilators coming in, and here we have a stockpile of ventilators, and we're starting to send them so that hospitals can fill up their stockpile, which they should have. New York had a chance to get 16,000 ventilators, and they chose not to do it, and I understand that. It's a hard decision for a thing that may or may not happen. I fully understand that. I'm not even complaining about that. I'm only saying this. Iran was a terror when I came into office. Right now, they don't want to mess around with us. They don't want to mess around with us. Two things. North Korea, same sanctions we've always had, except more. We haven't given anything. I think you'll hopefully take that back to the Wall Street Journal because they really don't understand it. They really don't. And with Iran, I mean, that's a different country right now. And they want to make a deal. The only reason they don't, they're being shamed in because the guy that gave them the sweetheart didn't want to met with them many times. He should have never met with them. And in my opinion, he's telling them, don't wait. Maybe Trump will lose, and then you can negotiate with a patsy, with a weak guy, and you'll take over between you and Russia. Nobody's been tougher on Putin. He knows it better than anybody. Nobody's been tougher on Putin than me. Look at the sanctions. Look at what I did with their pipeline going into Europe. Nobody even knew about it. I exposed it. Now everybody talks about it. I think it's a terrible thing for Germany to do. But at the same time, I have a very good relationship with Putin, and I was able to make a deal with Russia and Saudi Arabia and OPEC Plus. They call it OPEC Plus. That's going to save us, Texas, North Dakota, Oklahoma, other states, energy states, going to save us hundreds of thousands of jobs. And in fact, your paper wrote an incredible editorial for a change that Trump made a great deal for our country. That was a nice thing. I was shocked to see it coming out of the Wall Street Journal. Thank you all very much. We'll see you tomorrow. Thank you. Thank you very much.
How many asymptomatic people Is it possible to get that number from you guys?
How you doing? Well,
for all they've done to help really be a force multiplier for the state of Florida in a number of ways. And probably the biggest way has been with expanding testing. Not only have they been instrumental in starting and maintaining these drive-through testing sites, but also these teams go into nursing home facilities and doing the spot testing to try to identify asymptomatic staff members who may be infected. If you look now, Florida today, when we get the results in for today, will have crossed 250,000 test results, 250,000 test results. That'll be one for about 88 people, 87 people. That ratio is higher in the 3 southeastern Florida counties who've seen the most cases. And I think one of the things that we've seen, we got huge numbers of test results the last 2 days. We got 31,443 test results. So that yielded 2,332 new Florida resident cases. So if you look at the percent positive, that's the lowest 2-day percent positive we've had in probably 2 or 3 weeks. If you look at places like Palm Beach County, you're starting to see the percent positive go down. So those are all good trends and good signs. We're going to continue doing the drive-through testing because I think it's important for an awful lot of people. We also, I'm telling the Guard to expand the strike teams into the nursing homes and assisted living facilities. So they're working with the Department of Health and ACA to be able to do that because I think it's very, very important. We also this week launched 2 walk-up testing sites in Broward County. This is a way to reach a broader cross-section of the community. Not everyone has access to vehicles, and we think that that'll be a way to bring testing to more segments of the society. So we're going to continue to do that and try to replicate that model. What we're also looking to do as we go forward here, and as testing is going to continue to be an issue, is have relationships with commercial labs that can do high throughput testing. And by that we mean if you have an employee and someone may have a symptom, send them somewhere quick to get tested. You need to get a response, hopefully within 24 hours. Now, they do have rapid tests, but a lot of that's with hospitals and used in those settings. Maybe those will be wider available, but it probably is going to take some time. So we're working to put together relationships to be able to get thousands and thousands of tests, 5,000, 10,000 in each lab, turned around within 24 hours. I think that'll be very, very good, particularly as you're looking at what the next steps are for the state of Florida. You obviously are going to be having people that may be symptomatic and are going to go, and that's been pretty standard. But I think what you're also going to be needing to do is some type of screening testing. And it's not that everyone needs to get tested, because I think, as Dr. Fauci said, you can get tested negative and then you could acquire the virus 2 days later. So you're not going to test every day. But at least if you're looking in different communities to see whether there's any type of a bounce back on this, to be able to have that is going to be very, very important. So we hope to have some agreements in place very soon. The Surgeon General has been working on that, as well as Director Moskowitz. So we appreciate that. We think that'll be good. We also one of the most important studies that's been done just this week came out at Stanford University, where they tested the antibodies in Santa Clara County, California. And so these are people who have the antibodies from the coronavirus. The thought is that they had acquired the virus. Many of them may not have known that they had had it, but they looked to see how prevalent those antibodies were in that county, and they determined that between 50 and 80 times more people in Santa Clara had the antibodies than had actually tested positive in Santa Clara County. So we think that that's important information, and we want to see that here in Florida. We're working with a company that does blood donations, and they're going to screen the blood for these coronavirus antibodies. We also have a number of these antibody test kits. They're supposed to come in this coming week, but I think as we've seen in this process, you never really know how that is all going to work out. But once we get that, we're going to be able to take that and use that strategically, because it is important to know if, in fact, the number of people who've actually tested positive is just a really small fraction of who's actually had the virus and who currently has the antibodies. That's going to inform a lot of policy making going forward. And so we're very much working on getting some of these seroprevalence studies done in the state of Florida. Today I'm also announcing that our K through 12 schools will continue with distance learning for the duration of the school year. We spoke with a lot of folks throughout the state. There was some differing opinions. Some parents were not interested in their kids going back. Some others, it's been tough around the house. They would have liked to have seen them go back. But I think as we looked at the clock and we looked to see what it would look like, we've got pretty good momentum for distance learning. It's not it's obviously not the ideal situation, but given where we are in the school year, we felt that was the best decision to go forward. I've also mentioned on Wednesday that I'm forming a task force for the rebound, Florida's rebound and resurgence. It will have a number of folks from businesses, industries. It'll have folks who are elected officials. We're going to announce the members of the task force on Monday, which will also be the first day that the group will meet by telephone. Task force will develop a three-stage approach to reopening the state: short-term, medium-term, and long-term. And we've always been looking medium and long-term in Florida, how we can do better. Some of that is probably going to be the same, but now with this situation, how can we use the back end of this and position ourselves for the most success going forward? So they're going to meet telephonically every day this coming week on the short-term strategy, and they're going to provide recommendations for me by the end of the week. Then, once we get that in place, they're going to look to the medium and long-term strategies, and we want to see people back to work for the long haul, and we want to continue with Florida's economic development strategy. We had a lot of great irons in the fire before this hit, and we want to be able to get that back going forward. Since the beginning of this crisis, probably our number one point of emphasis has been on long-term care and nursing home facilities. Very early on, we put strong guidance and regulations in place so that staff members, anyone who entered a facility, had to be screened for coronavirus symptoms. We also prohibited outside visitors, and then we required members of staff to wear PPE, things like N95 masks. This is something that's really important. And what we found is that you may have everyone doing everything right in one of these facilities, but you could have a staff member who's not symptomatic, and it can go and it could spread throughout the staff and spread to the residents very, very quickly. Because of that, that's why we did the National Guard strike teams. So we have them going to different facilities. They're doing spot testing. We're trying to, if we identify an outbreak, contain it so that it doesn't spread like wildfire throughout the facility. We also have a number of the hospital systems who've been working on this. Cleveland Clinic, for example, they will go in and work with the staff and residents and facilities in their area, and we want all the healthcare providers to be able to do that. As we look forward to opening up elective procedures and doing some of that, we want our hospitals to be able to say, we've got enough space, which we obviously have a lot of space in the hospitals now. We're going to have enough PPE to deal with any COVID eventualities, and we do have a plan, and we're willing to work on the nursing home situation in our respective areas. And if they're on board with that, then I think we can proceed with some of the elective procedures. So as of right now, the number of positive cases associated with nursing homes and assisted living facilities is 1,627. That includes residents and staff, and in some of these, the outbreak has affected the staff more. And we obviously have huge amount of both staff and residents in the state of Florida, probably more or just about as much as any other state. One of the things that's come up is, you have fatalities identified generally by county. What about individual counties and individual nursing homes? I told the Surgeon General from the beginning, we want to put as much information out as you can. Now, I don't think you should be identifying individual patients by name, but at the same time, just getting the information out, I think is better. So, and he's done a lot. I think if you look at the reports, when people have asked to do more, when they asked for the racial and ethnic breakdown, that was added. There were some other things that have been added along the way, but I have now directed him to determine that it is necessary for public health to release the names of the facilities where a resident or staff member is tested positive for COVID-19. Now, what had been done is as soon as there was a positive test, the facility was required to notify all the other residents, all the staff members, and all the families. And we have no reason to think that that wasn't done. We know it was done, most of the time, but at the same time, if you have one incident in a week from now and they don't follow through with that, I don't want to be in a situation where the families don't know. So that's going to be part of what is put out publicly. So they're working on doing that, and I think that that'll be a positive step forward. In terms of the travel, we have now screened people coming from the New York City area or New Orleans, almost 22,000 folks coming from those hot zones, and of course requiring them to self-isolate for 14 days. If you look at our hospital bed availability, when this all started, the thing people were most concerned about was the need to flatten the curve, because if you didn't do that, the infections could spike, hospitals could be overwhelmed, and that would obviously lead to excessive deaths for COVID patients, but also for other patients. And I think if you look around the state of Florida, we've been holding pretty steady at 42 to 43% of beds statewide being available. I think the number, as of last night, the number in the ICU statewide was probably as low as it's been in a week or 8 or 9 days. So I think people from around the state have seen a lot of stability. They're not seeing a flood of new people coming in, so we want to hope that trend continues, but clearly there's a lot of capacity here going forward in the state of Florida. We are giving updates by text, so for the latest updates on our effort to fight COVID-19, please text FL COVID-19 to 888-777. Again, that's 888-777, text FL COVID-19. Thank you. It was just a consultation. We had consulted with folks, and I think that there was a sense of, okay, we obviously weren't going to do it on May 4th, so it would have been probably the last couple weeks of May. We were doing the distance learning. Academically, would there have been a huge benefit? And I think most people thought not. Now, look, I'm sensitive to, a lot of our kids haven't seen friends for a while. So this has had social cost to it, and I want to figure out a way to overcome that. I think in the next phase, I think kids will have a little bit more to be able to do. But I think there was just logistical things. I think you had kind of a division amongst folks whether this was a good idea or not. And I think the last thing you want to do is force everyone in school and have half the kids not show up because their parents didn't want, have teachers not want to do it. So I think it was easier decision for me to make, knowing that we've done so well with the distance learning. You have huge participation. Florida's worked very hard to be a leader on that. We have folks all over the country watching what we're doing. So I felt that was a good thing. Yes, sir. I texted FL COVID-19 to 888-777 3 days ago. I got a confirmation that I was stand by, there's going to be something coming out. So you're going to get it. Yeah, you know, we're trying to be respectful. I mean, so we've put out a notice. We're going to do another one either today or tomorrow, and we'll continue to update. Obviously, as we get into the second phase of this, we're going to want folks to be able to know and have good information on that. So when you're doing this, I think people want to be informed, but there's sometimes, as many of you know, you just get emailed or texted all the time, and people, so we've tried to be respectful for it. We want to keep people, and obviously I'm doing public appearances every day, want to keep people in the loop, but we don't want to cause it to where they're getting annoyed by getting overwhelmed.
A couple questions. Thank you for addressing some of the testing issues, and I wanted to have you elaborate a little bit. You mentioned the importance of having these 24-hour turnarounds. Can you give us a little more information about how you're going to get to that point, and whether you're asking these labs to also produce the results and report to the state more quickly? So LabCorp and Quest are kind of the main ones. And when we all started this, it was all going through the CDC. That was slow, not a lot of capacity. The private labs came online, and they were promising 24 to 48-hour turnaround. So when we first started doing it, actually we probably got some for maybe a few days at 48 hours. But what happened was everyone was sending stuff there. They got backed up, and so they would turn it around sometimes 5-6 days is kind of the way it was. What's happened since then is, so there, and Dr. Birx has talked about this at the task force briefings, there is a lot more lab capacity out there, but for $50 a sample, a lot of labs weren't willing to go ahead and open up that capacity. So what Medicare, Medicaid, federal government have done is said, okay, it's $100 a sample, and so now you have more labs that are interested in doing it. So we've been in discussions with a number of them, some in Florida, some in other states, to where how many can you do a day? If we get them to you by this time at night, when will we get the results back? But this is something that nobody really had access to just a week ago. So it's a new thing. There's more of a financial incentive. So our hope is to have, we think we may have an ability to do it in Gainesville. We think we may have an ability to do one in Texas. And then I've also told the Surgeon General, let's get our state labs to have more high throughput testing. Because it would cost some money to do it, but if you pay $1 million for a machine and then it costs you less to run it than what it costs to be able to pay per test, because it's going to be $100 per test. And so if we plan on doing tens of thousands of tests a day, or even 10,000 tests a day, you know, that's going to add up pretty quickly. So if we have our own capacity, then that would be able to do a lot. So we're looking at both. We will definitely have an agreement with some lab to do high throughput within the coming days, and then we very well may see our state labs beefed up. When CDC initially did it, they wouldn't even let the state labs do it. So we would send it there. Then they said, okay, the state labs can do it, but if you get a positive, it's a presumptive positive, you still have to send it to us to get it confirmed. So it was not a good system, but our state labs do, I mean, they can do maybe 100 or 200 a day. They're just not set up to be able to do the high throughput. But I think we should do that, and we're thinking even about maybe just adding a fourth state lab, because we have Jacksonville, Tampa, and Miami, and we don't know what shape this is going to take this summer, but if we have hurricane season, got to shut down the coastal labs, it would be helpful to have something in the interior part of the state. So we're definitely looking at that for sure. Yes?
NASA is targeting May 27th for the resumption of human lunches from the U.S. Considering that many people want to congregate for this, is that a good idea?
Well, they can do it without having people congregating. I mean, we'll see what we're looking like then, but I think that NASA's mission is absolutely essential to this country, to our state, and the reports I've been getting were that even though this has been a real major, obviously, shock to the economy, that a lot on the Space Coast has been going very well, and so we want to keep that going. We don't want to miss a beat. You know, as we get into kind of the next phase, certain gatherings, you're not going to go right in to have huge crowds right away, of course, and so that may be impacted there. But I think by and large, if you let people know kind of, hey, what are the expectations, I think most people have been pretty respectful of that.
How often are they going to meet? Is it every day?
Yeah, so they're going to do, for the short term, they're meeting every day this coming week, and then I want some recommendations on my desk by the end of the week. So, hey, if they solve the world in 3 days, then they don't have to meet the rest of it. But I think that there's a lot of different issues that we're going to need to be working through. Some of the things we're going to be dealing with, because this has really had such a broad effect. I mean, agriculture, they've been affected by this. We're going to talk about some of the testing in terms of what we're looking to do here. I've also got a task force that's going to be a part of this, led by Pat Garrity from Florida Blue, about how else can we leverage private sector to really amp up the capacity. And some of that may be broader production of these quick tests, but even if you have the labs, if the labs could turn it around and you had a system, that would be pretty good. So we're going to do that. What does theme parks look like? Travel into Florida, and not just like we want people from Ohio to come here. What about international people coming here? How are the airlines going to handle it? How are the cruise ships going to deal with this? Now, they're not doing anything in May, but they said they want to start again in June. How is that going to fit into this? Because obviously that's been a source of friction in terms of our fight against COVID-19. What's restaurants? What's the restaurant industry looking like? How are we going to be able to get them back? How are we going to be able to do some of these other things? So when you kind of think about these things, but then when you actually sit down and write down the number of things that we've got to be smart about, I think that it's going to be very helpful to have that, I think.
Task force, what's it going to look like? I mean, who are some of the players that are going to be involved? How many are you going to have on the task force?
Well, we'll announce the whole thing on Monday, but what I've done is I've tried to get people from a variety of industries and particularly small business folks who have been the most impacted, but also elected officials throughout the state. So I've asked all the county mayors in Southeast Florida to be a part of it. We've asked other folks from around the state. I got people like Chris Sprouse and Wilton Simpson, who obviously Tampa Bay area and are going to be big honchos in the legislature. So I think it's a pretty good cross-section of folks. And these are folks who have seen this from different angles, and I think that's why it's really, really helpful. I mean, we kind of see it from the Tallahassee angle and going around, and obviously we've been focused so much on health, and you see the unemployment, you see some of these other things, but these folks are seeing it on the ground up about what can we do to help get their communities back on their feet. So I think it'll be good.
The presence of a marked vehicle at the governor's mansion. Then it went to 2, and even before Friday's incident, there have been times there have been 3 marked cars there. Are you seeing more threats on you in the office and the family?
I think it's just because there's been a little more protest. I don't know that I ever had a protest, or maybe I had 1 or 2, but I had the guy with the prison, and that was weird. And then some of the other folks who want to see Florida open up. Which, look, I'm with them. We got to get there, and we're working on it. So I don't know that it is. I think it's just the time. But we do have a situation where we've got 3 kids running around now. Well, the little one's not running around, but she's a bundle of joy. But she's also a lot to handle. My wife's doing a great job. But I'll tell you, Casey, because of the pandemic, besides having the baby, she's basically been at the mansion since the end of February. Hasn't really been able to do a whole lot. So as we see, do you need to get back? I mean, I just see kind of how it is to be inside and not be able to go just every day in my own house. And I think people they're going to be responsible. They want to be safe, but I do think they want to get back into a routine.
Some specifics on the nursing home. When will we have the facilities named?
I told them to do it. So I hope he gets it to you as soon as possible. It's not something that that we want to wait around on. And basically, my view is look, if this is going to potentially expose like a patient record, but I don't think it will. And I think it will actually be a double security because all these facilities are required to notify the families and required to notify the other residents and staff. And as I said, I think they all have done that. But all it takes, if one doesn't do it, I think I would want to know. So this way we're putting it out there. They will still have to notify personally via phone or email, but you'll also have this, and maybe it'll be on the public report, maybe they'll issue it separately. But I think it'll be good. Most states had not been doing it, but I think we're just looking at it, and I think there's other states that are moving in this direction too. And I think that it's important because if you look at this, and particularly if you look at this Stanford study to see the number of people who've had it, because that obviously affects the hospitalization rate and the fatality rate. And if you believe there's 50 to 80 times more people than we have documented, then obviously the hospitalization chances are lower and the fatalities are lower, which is a good thing. But if you look at it, once you get into those nursing home situations, it's, you have, that's really the biggest issue. So we want to do all we can to make sure that everyone is being safe. And I'll tell you, we came out very early on that, and I think that CDC recommended our model to other states. You're now seeing states move a little bit more aggressively to implement some of the things we did earlier in March, because they're seeing huge proportion. I mean, the numbers will come out, but I mean, the last time I looked, it was between 90 and 100 of our fatalities were connected to these facilities. Some of these other states that are a fraction of our size have had hundreds and hundreds of folks in these facilities. New York, I think, has had thousands, and it's a difficult thing, but I think the fact that we put a lot of emphasis on it and a lot of resources towards it has proven to be successful, and we just got to keep it up. The next phase, whatever every other part of the economy looks like, whatever type of measures are in place, whatever measures get relaxed, I can tell you we're going to continue on the path with the nursing homes and the long-term care facilities, and any way that we can even beef up efforts, we're going to be looking to do that. Thanks, everybody.